So we have an interesting case today. We have the lovely Olivia, who's a student in Nottingham, who's new to us. She's had some treatments previously before in her hometown, where she's from. She's had some non-surgical rhinoplasty or liquid nose job a couple of times over the years, over a few years, and always been really happy, and she's always gone to a medical professional, doctor, to have this treatment done. Now, she was at university and one of her friends was having the treatment done with a non-medical professional, a non-surgical nose job, and you went ahead with her and thought she'd have a little touch-up, really, a little bit added to her nose to refine it. It didn't work out in the way that you intended. So Olivia attended the appointment with the non-medical professional to have a liquid nose job, liquid rhinoplasty, and it didn't turn out the way that she intended. So she feels like the result of this is more bulbous than she expected. The whole experience she described as being quite traumatic, a lot more traumatic than everything she's gone through previously with medical professionals. It seemed like the needle was used quite a few times in that area, and she's just really not happy, and she was saying that she doesn't feel nice to sort of go out with her friends in the next couple of weeks where she's got some things planned, going to university and going to work. She doesn't feel like doing that, she really doesn't want to. If this treatment was carried out outside of the clinic or by myself, I would have been confident in my work and I would have said, let this settle, swelling is normal. However, saying that, it does look like this treatment was done in quite a traumatic way. I can see the needle has gone in quite a few times. Yeah. And because Olivia has had the treatment done several times before with a medical professional and never felt this way, I can tell this is something different. She's just really not happy with the result, even though it has only been a few days. When she did enter as well, there was a slight paleness to the tip of the nose, which didn't look too clever. This is something we really check. Capillary refill is really important, checking that the blood is flowing to the area. I have checked that. It looks like there is refill there, and the patient, Olivia, is not in any pain, which is brilliant. It seems like a really scary risk that could happen, vascular occlusion, when the vessels are either blocked or compressed by the filler. It seems like that complication hasn't occurred here. It seems like it is just potentially the filler that we can see in that area that is a little bit superficially placed. But weighing it all up, we have decided to dissolve for her today. So we've gone through consent, we've checked medical history, Olivia's feeling good, she's good to go. So we're going to proceed with a small patch test with Hylase, which is the prescription only drug that we're going to use to dissolve this today. Perfect, so we'll just leave that there and just check that that's okay in a few minutes. We'll leave you 10-15 minutes and just check you're feeling okay, and then we'll be good to go. Perfect, so we're good to go. Our patch test has been fine. We obviously before that signed full consent. We know that you're unlikely to be allergic to it. If ever a patient is allergic to Hylase, we have got EpiPens here at the clinic. We're all medical professionals and we can look after you. And we've completely numbed you up with using some numbing cream. So we're going to go ahead and dissolve that filler that you don't like, my lovely. One of the things to bear in mind, I know that you Olivia's lovely and she kind of regrets going to a non-medic, but we have been discussing this could have been worse. This could have been a vascular occlusion, a serious complication, and vascular occlusion in this area can cause immediate blindness. This hasn't happened. She just doesn't like the filler, but I think we've discussed that she is going to go to a medical professional from now on. But we'll look after you today, we'll make sure you're in good hands and we'll get you sorted. Okay, she's going to be a little scratch, my darling. You'll be absolutely fine there. Well done, my lovely. Perfect, was that okay?
Yeah, so fine.
Lovely, so nothing more dramatic than that, my darling. Perfect, so the filler was placed in a couple of different areas, I can see that, so we're going to have to approach that from a few different places, my lovely. And then we'll be good to go. And the Hylase here works pretty immediately actually, so it will start working in the next half an hour. A lot of the dissolving will be done, but it will be a little bit swollen after the treatment, which I know you expected. And hopefully we can get that all gone for you. And if we're going ahead with a further non-surgical rhinoplasty, I would let this settle and heal for a good few weeks. And then potentially we can rebook you in here and we can get you sorted out in a safe way and hopefully get a result that you do like.
Perfect, thank you.
No problem at all.